Hi, my name is Deb. My patients call me Dr. Ghosh. I'm a consultant. I work in NHS. I'm a consultant gastroenterologist with special interest in liver disease. I'm also trained in general medicine. Next week, Sunday, 11th of April, I'm going to run a 10-kilometer charity run for St. Clare Hospice. The fund I'm going to raise is going to be distributed between St. Clare Hospice and British Liver Trust. I also shift my head because my patients told me that they will give more money if I do that. So done that. Thank you. 11th of April also happens to be the anniversary that I came home last year from hospital with severe COVID pneumonia. I was born with one lung. There was no lung on the right hand side. I had multiple lung resections in my 20s, and that's probably I went down with COVID and that bad. So lying in the hospital bed, I'm hearing about unfortunate death of few of my colleagues and my other friends abroad. And for the first time, it flashed to my mind that it might be it. And in a mental haze, I was trying over phone to tell my wife my bank password, bank details and password, and where I have kept my will, etc. And she was crying over phone, and she lost her smell. My son was having temperature, so it was a total chaos. And for the first time, I realized what I heard long time ago. The Chinese philosopher Confucius said that every man lives two lives, and the second life begins when he realizes that he's mortal. So this, my life now, is my life version 2. I qualified in 1992, so next year I'll be celebrating my 30th year of being a doctor. Outside my job, my passion, my interest is to find out about human body and human mind, and how we can trick and hack it and make it do things that it will give us the maximum benefit and productivity out of this one life, and to convey that to my patients in simple terms. The problem with our health system, and not only UK, anywhere in the world, is that there's too much firefighting for ill health, so that we cannot find time and energy to focus on promoting health. Now, my advantage is that I grew up in India, and I have been exposed to the ancient culture of healing with food, with yoga, with pranayam, the breath work. And I have coupled that with the modern state-of-the-art medicine, both in Calcutta and over here. And I have seen the benefit and disadvantage of both sides of the paradigm. In my career, almost spanning over nearly 30 years, I have broken many bad news, but given more happy news, sent more patients home in a better shape than they have come in. Now, over and over, the pattern remains the same. Unless we take our own health in our own hand and we install in our day-to-day life some healthy practice, nature will take its course. And the result might not be death, but the suffering that will go through, which might last months or years, is not only you who suffer, it's everybody around you, from depression to addiction to obesity, back pain, chronic illnesses. Even some of the cancers are also related to the lifestyle choices that we make. So as I the famous saying that from your birth to death, the B to D, in between there is choices, the C, the letter C, that the choices that we make on a moment-to-moment basis that ultimately shapes our destiny. Now, what choices are we making? I have come to the conclusion that there are 7 pillars of health, and if you neglect one pillar, then the whole health breaks down. And the 7 pillars being your sleep, food, movement, your mental health or EQ, emotional quotient, and then your brain health or cognitive health or IQ, then your social health or connection health, how well you're connected to the other people around you, your neighborhood, your family, friends, colleagues, and to the greater world. And finally, although it's not health in that sense, but it is financial health and your productivity health. And that, if you don't pay attention, it is going to sort of send the toxins to all other areas of health, and finally your health goes down. So these days, if you want to Google sleep, Google movement, Google food, you can have multiple gurus talking about it. But what was kind of difficult for me to understand, that they are the gurus, they're the sleep expert, they're the food expert, they're the physiotherapy expert, but what they are doing or teaching, can I do? Like my other colleagues, I'm a very busy doctor. I've got a busy job in both NHS and private sector, and I'm a busy husband, I'm a busy father. I've got a 17-year-old son and a 12-year-old daughter and a 6-month-old Yorkie called Coffee, who apparently was born on the same day that I was born. I didn't know that when I got the puppy during the lockdown. So can I do what all these health experts are telling us to do? So that was the mission, and over months and years, I have kind of distilled all the several health practices spanning over all the 7 pillars of health into minimum effective dose that maybe if I can do, you can do, and turn our disability into our special ability. And sometimes I feel that those who are given a handicap in their life are the people who will work their asses off to overcome that handicap and turn it to their advantage. Like I probably run, and I'm probably so much health conscious on a personal level because I was born sick, because we didn't know that we had only one lung, and as a kid I was suffering from recurrent chest infections. I couldn't participate in any sports, and now I run on a regular basis. I do a 10-kilometer almost most Sundays, and a 2-kilometer every night or every morning. So if I can do it, you can do it. I'm not a guru, but if you want to learn with me, join me in my mission to blossom, to fulfill whatever we were born to fulfill. So it's happiness, it's joy. Yes, there'll be pain, but there'll be no suffering. As Gautam Buddha said, that the suffering is the second arrow. We cannot avoid the first arrow. It will hit all of us in many ways, like I was hit with COVID. But the second arrow is the suffering that we suffer in our brain, in our mind. We don't have to suffer from that. So watch me running next week Sunday, and please donate using the links. Support St. Clare Hospice, support British Liver Trust. They're the 2 great organizations. They're doing fantastic stuff to support people who are really in need. So all the best. Wish us luck. Thank you.